Turning now to your community focus. This week we've told you about a new COVID shot and an FDA ruling on common cold and flu medicines. Joining us now to talk about that and other health tips for your kids this time of year is Dr. Elizabeth Lange with the Rhode Island chapter of the American Academy of Pediatrics. Thanks so much for being here.
Thanks for having me.
So I want to start with the latest on COVID. A few days ago, the CDC recommended a new vaccine for all Americans. Walk us through what's available.
Well, we're very excited that there is a new vaccine available. Certainly vaccination is our best way to protect against serious infection, not only for the patient, but for the people around them and their loved ones. So as we continue to learn what the recommendations are for children with this vaccine, the overarching theme is that COVID vaccination is an important thing to do. If people have not had their COVID vaccine yet, recommend that they get one, and that we all get this newest version that is coming out this week.
And there are, of course, other respiratory illnesses that parents and children should be aware of, like flu and RSV. What should parents know about ways to prevent those?
So certainly vaccination is still a very good way of preventing serious illness. Influenza vaccine is recommended for everybody 6 months and older. This year we're lucky enough to have an RSV vaccine for not only the grandparents but also for young babies, and that will hopefully be rolling out in the middle of this season. But just the good old-fashioned things of staying home when we don't feel well, washing our hands well after we sneeze or cough, not sharing food or drink with other people, and seeking doctors or medical care if you don't feel well and have a prolonged fever, any trouble breathing. Just the good old-fashioned things.
And specifically with the flu vaccine, the CDC released some new guidance saying people with egg allergies are clear to get the vaccine, sort of changing, I guess, maybe previous guidance. What changed there?
Well, I think the best thing about science is that we constantly learn and relearn and re-examine things. And so in this particular instance, studies have shown that people with egg allergies are able to tolerate the flu vaccine, but this is always a conversation in consultation with your primary care physician to decide what is best for you and your family if there is an egg allergy in your family, or specifically a significant egg allergy.
And also this week, the FDA ruled that an ingredient in most over-the-counter decongestants, things like Benadryl, Tylenol, is not effective. What is your reaction to that, and do you think this will have any sort of impact as we approach cold and flu season?
Well, as pediatricians, we don't recommend a lot of cough and cold medicines. So for children, this change doesn't change very much. But it is a reminder that all of these medicines over the counter may help to make symptoms a little bit better. They may not either. So the good old-fashioned things of chicken noodle soup and rest and tea and honey and just rest for sure, Tylenol or Motrin can be helpful. And then a cough and cold medicine if it does make a difference. In this particular instance, the studies show that this particular ingredient does not make much of a difference. And so we look forward to continue learning more about other cough and cold medicines too.
Now, aside from preventing illnesses, getting into a routine is also vital for making sure that kids have a good school year or just a good time in general. What is some advice that you would give to parents in terms of things like sleep, exercise, that sort of thing?
Well, for all of us, our immune system works its best when we are well rested, when we are well fed, and when we've had good exercise. So making sure, for children in particular, get to bed at a decent time, have an electronic curfew so kids are not on their screen time right before bedtime, and having that routine consistently 7 days a week. Having enough nutrition. Many families don't have enough food, so if that is the case for your family, please talk to your pediatrician, as we have some resources to offer to help make sure that families have enough food. But well-balanced meals, 3 meals a day, starting with breakfast, is important, and exercise. Just getting outside and having some fresh air is also very helpful, and all those things keep our body healthy, which then makes us less likely to get sick with the illnesses that circulate when we're all indoors in the wintertime.
A lot of good advice here. All right, Dr. Elizabeth Lange, thanks so much for joining us here at 4.
Thank you.